6 types of eating disorders. Although the term eating is in the name, eating disorders are about more than food. They're complex mental health conditions that often require the intervention of medical and psychological experts to alter their course. In the United States alone, an estimated 20 million women and 10 million men have or have had an eating disorder at some point in their life. This video describes 6 of the most common types of eating disorders and their symptoms. Eating disorders are a range of psychological conditions that cause unhealthy eating habits to develop. They might start with an obsession with food, body weight, or body shape. In severe cases, eating disorders can cause serious health consequences and may even result in death if left untreated. Before going to the types, if you are new to this channel, please subscribe to this channel and press on the bell icon for more interesting videos. 1. Anorexia nervosa. Anorexia nervosa is likely the most well-known eating disorder. It generally develops during adolescence or young adulthood and tends to affect more women than men. People with anorexia generally view themselves as overweight, even if they're dangerously underweight. They tend to constantly monitor their weight, avoid eating certain types of foods, and severely restrict their calories. Obsessive-compulsive symptoms are also often present. For instance, many people with anorexia are often preoccupied with constant thoughts about food, and some may obsessively collect recipes or hoard food. Such individuals may also have difficulty eating in public and exhibit a strong desire to control their environment, limiting their ability to be spontaneous. Anorexia is officially categorized into 2 subtypes, the restricting type and the binge eating and purging type. Individuals with the restricting type lose weight solely through dieting, fasting, or excessive exercise. Individuals with the binge eating and purging type may binge on large amounts of food or eat very little. In both cases, after they eat, they purge using activities like vomiting, taking laxatives or diuretics, or exercising excessively. Anorexia can be very damaging to the body. Over time, individuals living with it may experience the thinning of their bones, infertility, brittle hair and nails, and the growth of a layer of fine hair all over their body. In severe cases, anorexia can result in heart, brain, or multi-organ failure and death. 2. Bulimia nervosa. Bulimia nervosa is another well-known eating disorder. Like anorexia, bulimia tends to develop during adolescence and early adulthood and appears to be less common among men than women. People with bulimia frequently eat unusually large amounts of food in a specific period of time. Each binge eating episode usually continues until the person becomes painfully full. During a binge, the person usually feels that they cannot stop eating or control how much they're eating. Binges can happen with any type of food but most commonly occur with foods the individual would normally avoid. Individuals with bulimia then attempt to purge to compensate for the calories consumed and relieve gut discomfort. Common purging behaviors include forced vomiting, fasting, laxatives, diuretics, enemas, and excessive exercise. Symptoms may appear very similar to those of the binge eating or purging subtypes of anorexia nervosa. However, individuals with bulimia usually maintain a relatively normal weight, rather than becoming underweight. Side effects of bulimia may include an inflamed and sore throat, swollen salivary glands, worn tooth enamel, tooth decay, acid reflux, irritation of the gut, severe dehydration, and hormonal disturbances. In severe cases, bulimia can also create an imbalance in levels of electrolytes, such as sodium, potassium, and calcium. This can cause a stroke or heart attack. 3. Binge eating disorder. Binge eating disorder is believed to be one of the most common eating disorders, especially in the United States. It typically begins during adolescence and early adulthood, although it can develop later on. Individuals with this disorder have symptoms similar to those of bulimia or the binge eating subtype of anorexia. For instance, they typically eat unusually large amounts of food in relatively short periods of time and feel a lack of control during binges. People with binge eating disorder do not restrict calories or use purging behaviors, such as vomiting or excessive exercise, to compensate for their binges. People with binge eating disorder often have overweight or obesity. This may increase their risk of medical complications linked to excess weight, such as heart disease, stroke, and type 2 diabetes. 4. Pica. Pica is another eating disorder that involves eating things that are not considered food. Individuals with pica crave non-food substances, such as ice, dirt, soil, chalk, soap, paper, hair, cloth, wool, pebbles, laundry detergent, or cornstarch. Pica can occur in adults, as well as children and adolescents. That said, this disorder is most frequently observed in children, pregnant women, and individuals with mental disabilities. Individuals with pica may be at an increased risk of poisoning, infections, gut injuries, and nutritional deficiencies. Depending on the substances ingested, pica may be fatal. However, to be considered pica, the eating of non-food substances must not be a normal part of someone's culture or religion. In addition, it must not be considered a socially acceptable practice by a person's peers. 5. Rumination disorder. Rumination disorder is another newly recognized eating disorder. It describes a condition in which a person regurgitates food they have previously chewed and swallowed, re-chews it, and then either re-swallows it or spits it out. This rumination typically occurs within the first 30 minutes after a meal. Unlike medical conditions like reflux, it's voluntary. This disorder can develop during infancy, childhood, or adulthood. In infants, it tends to develop between 3 to 12 months of age and often disappears on its own. Children and adults with the condition usually require therapy to resolve it. If not resolved in infants, rumination disorder can result in weight loss and severe malnutrition that can be fatal. Adults with this disorder may restrict the amount of food they eat, especially in public. This may lead them to lose weight and become underweight. 6. Avoidant, restrictive food intake disorder. Avoidant, restrictive food intake disorder is a new name for an old disorder. The term replaces what was known as a feeding disorder of infancy and early childhood, a diagnosis previously reserved for children under 7 years old. Although avoidant, restrictive food intake disorder generally develops during infancy or early childhood, it can persist into adulthood. What's more, it's equally common among men and women. Individuals with this disorder experience disturbed eating either due to a lack of interest in eating or distaste for certain smells, tastes, colors, textures, or temperatures. It's important to note that avoidant, restrictive food intake disorder goes beyond normal behaviors, such as picky eating in toddlers or lower food intake in older adults. Moreover, it does not include the avoidance or restriction of foods due to lack of availability or religious or cultural practices. The categories above are meant to provide a better understanding of the most common eating disorders and dispel myths about them. Eating disorders are mental health conditions that usually require treatment. They can also be damaging to the body if left untreated. If you have an eating disorder or know someone that might have one, seek help from a healthcare practitioner that specializes in eating disorders. Comment down if you have any eating disorder and let us know. Thanks for watching.